Thank you very much. So what we're going to do is that we're going to get our briefing underway. My name is Motalatale Mudiba, the Gauteng Department of Health Head of Communication, and then I'll just introduce our panel here so that we get underway with the briefing. In terms of our panel, you already know the MEC who's seated in the middle, the MEC for Health and Wellness in Gauteng, MEC Nomantu, Nkomo-Ralehoko, and then with her on the left, it's the acting head of department, Lisiba Malotana, and then on that far side, on the MEC's right hand side, we've got the acting CEO for Forensic Pathology Service. So his name is Mr. Mpatlaza. So the three of them, MEC is going to address us. I know there's a number of challenges that have arisen in relation to this particular mortuary that we're at, but also generally around forensic pathology services. She's going to address us on that in terms of some of the interventions that the department is making. Once she's done, we will take a round or so of clarity-seeking questions, and the colleagues that are up front here, where necessary, they will also chip in terms of elaborating on some of the things. So without any further ado, MEC, over to you.
Thank you, Chief Director. Greetings, ladies and gentlemen. I would like to thank you for honoring this invitation at such a short notice. We have embarked on a journey as the Gauteng Department of Health and Wellness to transform our service platforms to ensure that they are responsive and address issues that are raised by service users and the public at large. During the 2023-24 budget vote address in May, I made a number of pronouncements, and one of them was that we are going to zoom into the Gauteng Forensic Pathology Service and begin to change how we provide services to our clientele through the introduction of a number of innovative interventions. We are repositioning Gauteng FPS. We are moving away from being about processing dead bodies to being about walking the last journey with bereaved families and ensuring that even in their moment of grief, they can find solace in the fact that we have handled their matter at the utmost dignity. Some of the issues that have been troubling our forensic pathology service for the longest time is the backlog of unidentified and unclaimed bodies in some of our mortuaries, and the poor turnaround time and finalization of post-mortem reports and their capturing. We know that at some stage, one of our mortuaries, especially the Johannesburg Forensic Pathology Service, which many of you know as HILLBROW Mortuary, there has been an outcry where you find that over the weekend, families who want to bury their departed loved ones would have been frustrated as they could not get access to the mortuary remains due to the process that was taking long to complete. We would like to sincerely apologize to all those families who have been subjected to the undue difficulties in their moment of grief due to inefficiencies in the system. We are now remedying the situation. We have begun the process of transforming our FPS through a number of interventions. One of these interventions has already been unveiled, and some of you might have covered this digital innovation, which has helped to improve the quality of fingerprints collected, resulting in a quick turnaround time when it comes to the identification of the deceased. Through the FPS digital fingerprint system, we have been able to identify bodies and trace families of unknown unclaimed bodies. This system uses biometric scanners and third-party access to the Department of Home Affairs, South African Police Service, and National Credit Bureau database to identify deceased bodies and trace their relatives. In terms of Johannesburg Forensic Pathology Service and other mortuaries in the province, we have made a number of interventions, and they are as follows. The first one, on Monday, the 24th of July 2023, we appointed a provincial task team to assist in the soaring number of bodies being admitted across the province. Intervention has seen a quick turnaround in post-mortem examinations in our facilities, which we really appreciate the team that has been working daily to ensure that these results are achieved. This task team was appointed as part of efforts to tackle the backlog in post-mortems at FPS mortuaries as a result of mass fatalities, cases with outstanding medical history, cases that necessitate stakeholder involvement, such as South African Police Service, correctional services, or a comprehensive medical history, among others. At a particular time, HILLBROW Mortuary alone, this move has resulted in 139 bodies being examined between 24th and 31st of July 2023. Out of the 139 bodies examined, 96 of them have been claimed or collected by their families, while 43 is still awaiting collection. In order to ensure uninterrupted service and speedy examination of bodies and their release to families without delay, then members of the task team are providing this support on a 24-hour basis and 7 days a week basis until we have for the next 30 days while we finalize the other processes. Currently, there are no backlogs of postmortem in any of our mortuaries across the province. This morning alone, 14 postmortems were conducted and those bodies were admitted yesterday. As part of efforts to address staff shortage in our mortuaries, a process is underway to recruit specialist forensic pathologists to fill positions which became vacant due to staff attrition. We are also looking at recruiting previously employed forensic pathology doctors to perform sessional autopsy duties. Another ongoing process of recruitment is underway. We will soon advertise 7 newly created positions of doctors who will be placed across FPS mortuaries in the province. The Gauteng Department of Health is looking at capacitating its mortuaries dealing with complex cases with in-house specialist forensic pathologist doctors to reduce the number of referrals to other facilities. Among these facilities is the Sebokeng Forensic Pathology Service, which is currently referring complex cases to this HILLBROW Mortuary. And we are making intervention in this area to capacitate Sebokeng FSP. As part of efforts to finalize long-standing postmortem reports, we have on the 8th of July 2023 launched another project to ensure the speedy capturing of these reports, which resulted due to staff shortage and inadequate equipment. The process to procure 150 computers to support this special project, which will improve our recording and capturing of postmortems, is at an advanced stage. In addition, through the Presidential Youth Employment Initiative, we are recruiting 200 unemployed young people to assist in converting written postmortems reports into digital files. This move will assist the judiciary in deciding on cases admitted to court while reducing SAP's case backlog, especially those that are murder-related cases. As the Gauteng Department of Health, we understand the frustration of families who are unable to access their bodies of their loved ones at the time they need them. Although we strive to perform our duties as efficient as possible, we wish to make public aware how forensic pathology services are rendered. The average time from admission to examination nationally is 72 hours. However, this excludes exceptional cases that require advanced investigations. Such cases include those of multiple gunshots, anesthetic-related death in police custody, police killings, murder, rape cases, and suspected poisoning, to name a few. These are some of the things that result in delay in issuing of bodies to families. In collaboration with South African Police Service, we will be extending our awareness campaign to inform and educate the public about Forensic Pathology Service. This campaign will be highly publicized on various media platforms, including departmental platforms. Ladies and gentlemen, we need to address the elephant in the room, which is the burial societies or undertakers who unashamedly take our grieving families for a ride. We are aware of some of those undertakers that do not have resources, such as the required freezers. Some of them have been giving grieving families to pay for their services when they in fact keep the bodies in our own facilities and come collect all those bodies on Fridays, knowing that the funeral is on the next day. With these undertakers, we are telling you is that they are enjoying this backlog of postmortems in our facilities. They are creating it, in fact. We've heard from reliable sources that they use this opportunity to cash in on grieving families by requesting that they pay an extra 2,000 with a promise that they will engage our mortuaries to prioritize a case of their families. We would like to plead with families who have been made to pay any cent by these undertakers, claiming that they will ensure that our mortuaries prioritize and escalate their members' post-mortem case, to come forward and inform us so that we can take action against these people, and any employee that is involved in our mortuary will be brought to book. We have been alerted of a family member who was asked to pay money by one of these undertakers. We are pleading with them to come forward so that we can deal with these unscrupulous funeral parlors that continue to rip off poor grieving families. Ladies and gentlemen, we are working around the clock with the Gauteng Department of Infrastructure Development to ensure that commissioning of Forensic Pathology Service facility building that is in Auckland Park near Helen Joseph Hospital. This facility will provide in-house laboratory services which will process all cases with ancillary investigations such as histology, toxicology, and many more. Currently, the Gauteng FPS is depending on external laboratories such as National Health Laboratory Services, Forensic Chemistry Laboratory, and Forensic Science. We commit to keeping the public updated on the intervention